About a month ago, we reported that nationally, drug overdoses were down in 2018, and that's according to the latest data from the CDC. In North Dakota, that's true too. Deaths went down from 76 to 66 between 2017 and 2018, but that trend downward slowed in 2019. And while there isn't statewide data yet for 2020, police in the capital city are sounding the alarm. Renee Cooper reports.
None of this stuff's worth dying for.
Bismarck Police Sergeant Michael Bolmy says the availability of naloxone, or Narcan, has to be to blame for a nationwide decrease.
It has to have countless saves nationwide. Plus, I think the awareness is finally starting to kick in.
He says BPD officers have been equipped with Narcan for about 3 to 4 years now. Even so, he says overdoses remain a constant for the department.
All of them are concerning because we treat all of those fatal overdoses. We basically have to work those like homicides.
Here are the statistics from the last 3 years. Bismarck Police just started tracking fatalities in 2019. And this morning, Bismarck Police told us there have been 12 overdoses already in 2020. And as of the last day of February, the city has already surpassed the number of overdose deaths from all of 2019 by 2. One happened just last night.
You're looking at such a small statistical anomaly that it's hard to make guesses on what's going on as far as numbers. When you see a city like ours have a statistical jump, it could also be a bad batch out there too.
The state started trying to tackle the problem over a decade ago. And Laura Anderson with the Department of Human Services says in 2017, they ramped up the efforts with federal funding.
Providing public education and training individuals to know if someone's at risk. Knowing, when they see someone who may have overdosed, what they can do.
It all goes back to naloxone. She says if you know someone at risk, it's something you'll want to keep around. Sergeant Bolmy says overdoses are still underreported.
People are so reluctant to call for help in that situation because I think there's still that stigma out there that they're going to get in trouble. We do honor the Good Samaritan law. If somebody stays and does the right thing, they're not going to get charged.
Reporting for KX News in Bismarck, Renee Cooper.
And an important note from Sergeant Bolmy, 1 dose of Narcan won't necessarily save someone's life, depending on the strength of the drug or how much is in someone's system. He says even if you have administered it to someone overdosing, still get them to the emergency room immediately.